This presentation is brought to you by the American College of Chest Physicians. It will provide you with a brief overview of administrative and regulatory advocacy, with a focus on the federal level. Regulatory advocacy falls under the general umbrella of administrative advocacy. Also included in the category of administrative advocacy are attempts to influence the operations of the executive branch or the regulatory department or agency itself. This can be thought of as executive branch or agency advocacy. For example, attempts to try and change operating processes or change budgets of an agency would be considered to be a type of agency advocacy. In order to create new regulations or effect changes in the existing regulations or regulatory process, we must have a general understanding of their source. Who makes these regulations? In the case of federal regulations, the source ultimately lies within the federal executive branch, also referred to as the federal administration. It is the executive branch that carries out the will of the legislature. The legislature often leaves their legislation vague so that agencies which have more expertise can fill in the details. The federal executive branch consists of the president, the vice president, the executive office of the president, and the cabinet. The cabinet, in turn, consists of the heads of 15 executive departments, which form an advisory board to the president. The head, or secretary, of the Executive Department of Health and Human Services is one member of the federal cabinet. Executive branches are also found on the state and local level and are responsible for carrying out the will of the state or local legislative body. The state executive branches are not identical to that of other states, but they do follow the same general structures and carry out similar functions. They consist of the governor and lieutenant governor, the governor's cabinet, agencies and departments, for example, a state department of health, and many states have independent agencies, boards, or commissions as well. These agencies or departments can promulgate administrative regulations. Local executive branches are also non-identical across the board. They consist of the city mayor or county executive and/or the town manager. They also have various local agencies, for example, a county department of public health. Again, these local departments, agencies, or districts can often promulgate administrative regulations. Now, these executive branch agencies that we talk about are initially created by Congress through what is called enabling legislation. They are charged by the legislature to enforce statutes. But remember, once created, these agencies are part of the executive branch. They use rulemaking, or otherwise known as regulatory functions, to detail the nuts and bolts of the laws passed by the legislature. And they have powers of enforcement for existing regulations that they promulgate. Rulemaking responsibilities are divided amongst the different executive agencies. Regulations may be issued by a single agency or by multiple regulators to address all aspects of a particular law. For example, healthcare fraud and abuse laws may be accompanied by regulations promulgated by the Department of Health and Human Services, the Centers for Medicare and Medicaid Services, the Internal Revenue Service, the Department of Justice, and possibly other agencies or departments. In order to remember the difference between a regulator and a legislator, just remember that a regulator is not elected, while a legislator is. What exactly are these rules and regulations that these agencies create? Well, there's a statute called the Federal Administrative Procedure Act, or the APA, which details the rules and processes by which regulatory agencies can create regulations. The APA defines a rule or regulation as the whole or part of an agency statement of general or particular applicability and future effect designed to implement, interpret, or prescribe law or policy, or describing the organization, procedure, or practice requirements of an agency. What we can see from these last few slides is that rules and regulations really define a law created by the legislature. They're developed and adopted by federal, state, and local agencies to help implement federal, state, and local laws. Regulations define a government agency's specific organizational structure and its operating procedures as well. As an extension of this concept, you can see how rules and regulations will also detail the administration of programs under an agency. For example, there are rules that detail how the Medicare program is run by CMS. This means that one can address a regulatory activity from two main perspectives. First, one can address the regulation on its face and argue that the regulation has unintended effects, it is unfair, or that it does not serve its original purpose. Second, one can address the regulation by attacking the method in which the agency made its decision and created the regulation. For example, you can claim that the agency was acting outside of its authority in making the rule. Or you can argue that it did not follow its own structural or procedural rules in the process of creating the regulation. Finally, one of the other things that we have learned about rules and regulations is that they have the force of the law. You must obey them, otherwise there will be penalties which are also delineated in the regulations and in the law. There are several general steps that go into the creation of a federal regulation. First, the law is passed by Congress. Second, Congress authorizes the appropriate executive branch agency to create regulations that govern the day-to-day operation of the law. As per the Administrative Procedure Act, every proposed federal regulation must be published in the Federal Register as a notice of proposed rulemaking. There is a certain period of time during which the public can provide comments on the proposed regulation, and in some cases, public hearings must be conducted. Notices are published in the Federal Register. A final rule is published once the comments are considered and the proposed regulation is revised. The final rule is printed in the Federal Register, published on the agency website, and then added to the Code of Federal Regulations. Similar processes and publications exist in most states. However, not every state has a law like the APA. Now that you have had a general understanding of the executive branch, regulatory agencies, and the rules and regulations that they promulgate, you can see that one way to influence the executive branch is to engage in administrative and regulatory advocacy. You can do so by monitoring program operations, serving as volunteers, serving on agency advisory bodies, filing comments on the regulations that govern how programs are implemented, directing public attention to proposed regulations, asking elected representatives to monitor programs and comment on draft regulations, challenging policies or regulations in the courts whenever they prove inconsistent with the law, and otherwise participating in the decision-making process of an agency. One particularly useful example of regulatory advocacy is commenting on proposed regulations from an agency. Individuals or organizations like to provide comment because usually a good effort is made to incorporate the viewpoints presented by the various commentators. Comments are also a good way to contribute your expertise and put your view on record. Also, lawyers for your organization or company will look to the comments to determine the meaning of particular regulations. Once a regulation has been analyzed to see how it may impact you or your organization in either a negative or positive manner, you would create a comment letter that would be sent to the appropriate agency. There are three main methods of submission. You can use the Federal e-rulemaking portal online, you can use mail or hand delivery or courier. If you use the Federal e-rulemaking portal, you can find the rule online by searching regulations.gov. On that website, you can have access to the entire document and find access to the rule, other documents related to the rule, and a link to the comment page. Under the title of the proposed rule, take note of the last date for submitting comments. Then you can submit your comments online in the box provided or by adding an attachment. Now, just as an aside, it's good to know that a more direct route can be taken as well, simply by asking a legislator to comment on a proposed rule. Legislators, especially those that serve on committees that oversee the particular agency, can have a great influence on rules and regulations. But remember, when bringing a legislator into your efforts, this will be viewed as legislative advocacy. Now, what agencies should you pay attention to? As a healthcare practitioner, you would be most interested in the regulatory functions of HHS and its sub-agencies. The Department of Health and Human Services, or HHS, is the main agency responsible for the protection of health of all Americans. It provides essential human services. The department's programs are administered by 11 operating divisions, including 8 agencies in the U.S. Public Health Service and 3 human service agencies. These include the Centers for Medicare and Medicaid Services, or CMS, the Food and Drug Administration, or FDA, the Centers for Disease Control and Prevention, or CDC, the National Institutes of Health, or NIH, and the Office of the Inspector General, or OIG. The Centers for Medicare and Medicaid Services, or CMS, is the operating branch of HHS, which administers Medicare. It also works in partnership with states to administer the MEDICAID program and the Children's Health Insurance Program. Pay attention to CMS regulations because CMS oversees most of the regulations directly related to the healthcare system. This includes healthcare services, healthcare delivery, and healthcare reimbursement. Examples of regulatory topics that provide advocacy opportunities are the Medicare payment policies under the Physician Fee Schedule, reform of Medicare conditions of participation, and Medicare premiums for Medicare beneficiaries. Another opportunity for advocacy lies within other operations of CMS. Medicare will only cover items and services that are reasonable and necessary for the diagnosis and treatment of illness or injury, as dictated by statute or the law. In order to administer the Medicare program, CMS also issues policies that are not regulations, such as NCDs and LCDs. These are national and local coverage determinations that help Medicare adhere to the standard by providing guidance and interpretation regarding particular circumstances and patient populations. NCDs are binding on local Medicare contractors. And when no NCD is available for a particular item or service, LCDs are issued by local Medicare contractors. This administrative activity by CMS, the issuance of these NCD and LCD policies, that is, provides an administrative advocacy opportunity because the public has an opportunity to help in the creation of an NCD and LCD, or issue a call for reconsideration. Now remember, apart from CMS, you should also pay attention to regulations and policies created by the FDA, the CDC, and the NIH, and HHS as a whole. We hope that this presentation was informative and provided you with a general understanding of the world of administrative and regulatory advocacy. Thank you for joining us, and please feel free to contact the ACCP's Chest Medicine Affairs Committee or the Council of U.S. and Canadian Governors if you have any questions by sending an email to smahajan@chestnet.org.